name is Angela Phelps, and I will be performing catheter care today. First thing I'm going to do is check my physician's orders and make sure that I have an order. Second thing I'm going to do, I'm going to check the patient's chart, assess it. I am looking for allergies, especially to betadine, iodine, or latex gloves. Next thing I'm going to do is I'm going to gather my supplies, get those together, and then I'm going to go in and I'm going to wash my hands, gather my supplies, and I'm going to wash my hands. Then I'm going to go identify my patient by looking at their name, their armband. I'm looking for name, date of birth, and any allergies. I'm going to introduce myself to the patient and let them know that the procedure that I'm going to be performing on them today. Then I'm going to get my goggles, put my goggles on, and put on non-sterile gloves, clean gloves. I'm also going to, before I even get started, I'm going to, number one, lock the bed physically. I'm going to tell the patient, once I put on my sterile gloves, I will not put my hands below my waist. I'm going to, and making sure, especially when I'm putting stuff in the trash, I'm not going to turn my back on my sterile field. I'm going to make sure that my patient's side rails and bed is in a comfortable, safe, and working position, and I'm going to provide privacy to the patient while I am doing this procedure. I'm going to put my gloves on. Again, I'm going to only uncover what I need to uncover. I'm going to tell the patient what it is I'm doing again, which is I'm going to be providing pericare. I'm going to make sure that the patient is in the correct position. For a female, it is dorsal recumbent, and for a male, it is supine. Once they're in the correct position, I'm going to let the patient know that I am touching them. I'm going to then provide pericare. I may tell them that it may be a little cold. Once I have provided pericare, I'm going to remove my gloves, discard them in the trash, and then I'm going to wash my hands. Then I'm going to get my Foley catheter kit, and I'm looking at my Foley catheter kit, making sure that it is not tampered with, that it is not expired, and it is the right size. I'm going to remove my kit from my bag. I may use this, I may not, I haven't decided. Now I'm going to open my Foley catheter kit, making sure my legs are okay. I'm putting it in between the patient's legs. I'm going to start with the furthest part away from me. And then I'm going to grab these two edges, only touching the outside of it. And then I'm going to grab this part and open it. Now that I got my Foley catheter kit open, I'm gonna apply my sterile gloves. I'm not gonna use the gloves in there. I have my own set. I've already inspected them. It's for expiration date and tampering with the package. Opening up my sterile gloves, making sure I only touch the quarter. I'm going to put it on my dominant hand first, which is my right hand. Then I'm going to put it on my non-dominant hand next, which is my left hand. Got my gloves on. Next thing we're going to do is I'm going to turn this so it is square. Square position. I'm going to remove my gloves. I'm going to remove my fenestrated drape because I don't need that. Then I'm going to take my blue drape out, and it's going to be shiny side down. Okay. Now I'm going to put this with the shiny side down, the drape with the shiny side down under the patient's hips. Now I'm going to take this tray out. And I'm going to put it on my sterile field. I'm going to remove this because I don't need it. I'm going to then open up these, put these in the pack, slides. I'm going to open the lubricating jelly, squeeze it in there. I'm going to get my syringe, take the top off of it, and I'm going to attach it to the port. I'm also checking the bag to make sure that the bag is closed. I am then going to remove the sheath from the catheter. And I'm going to place it back in here. Next, I'm going to then tell the patient that I'm about to touch them, and I'm going to clean the patient. I'm touching the patient. You know, it may be cool. I'm going to get one swab, go down, out, grab another swab, go down, out, last swab, straight down the middle, and out. Then I'm going to grab my catheter, and I'm going to generously lubricate the first 1 to 2 inches of my lubricating jelly. All right. Now I'm going to tell my patient that I'm getting ready to insert the catheter and they need to bear down. I'm going to insert the catheter 2 to 3 inches. Once I hit urine, then I'm going to insert it another 1 to 2 inches. Then I'm going to take my non-dominant hand, which is my dirty hand, and I'm going to grab my catheter tip so I'm holding it in place. Then I'm going to take my dominant hand and I'm going to gently inflate the balloon, the water into the balloon. Now I'm going to tug it, make sure that it is secure. Then I'm going to take my arm down, and I'm going to now clean up. I'm going to remove my bag from here with my clean hand and set it right here on the bed. Now I'm going to remove all my dirty stuff. Put it right there. I'm going to now take my gloves off, my sterile gloves off. I'm going to then wash my hands, and then I'm going to apply my clean gloves. My clean gloves. I'm gonna date, time, and initial my catheter. I'm going to then get my Foley catheter strap, and I'm gonna put that on here. I'm going to attach my Foley catheter strap. I'm going to hang my bag on my bed, making sure that it's not at a movable part. It's not a movable part of my bed. Take my gloves off. I'm going to wash my hands again. I'm going to apply another pair of clean gloves. And then now I'm going to provide peri-care to the patient to remove any excess betadine. Before I touch the patient, I'm going to tell them I'm touching you, and I'm going to provide peri-care. Once I provide the peri-care, making sure everything is in place and safe, I'm going to cover the patient back up. Make sure that I have provided privacy and safety for the patient. making sure that the bed is in the lowest position, call light is within reach, the patient is comfortable and doesn't need anything, and the side rails are up and the patient is safe. Then I'm going to go back to the chart and I'm going to document the date and time, what type of procedure that I did, what size Foley catheter that I put in the patient, how the patient tolerated the procedure, and I'm also going to document the size of the Foley catheter, and I'm also going to document the urine color and clarity. Make sure all of that is in the chart. And that is it for inserting a Foley catheter. Now I'm going to remove the Foley catheter. So to remove the Foley catheter, I'm going to check the physician's orders again, seeing that I have an order to remove it. I'm going to make sure that I have my supplies, which are just my cleaning gloves, my wipes, my paper towels, and my urinal. I'm going to go in. Of course, I'm going to provide privacy to the patient. I'm going to explain to the patient what it is that I'm about to do. I'm going to then make sure my hands are washed and put on my clean gloves. First thing I'm going to do is I'm going to grab a paper towel, put it down here on the floor so I can empty the urine bag. So once I've emptied the urine bag, I'm going to take the urine in the bathroom. I'm going to measure it. Then I'm going to dump it in the toilet. I'm going to, if it's urinal, I'll put it back by the bed for the mail. If it's a specimen, I'll leave it in the bathroom. Once I've emptied it in the toilet, I'm going to take my gloves off. I'm going to wash my hands, and I'm going to put on some clean gloves. Now that my clean gloves are on, I'm going to grab my paper towel. I'm going to need that. I'm going to uncover only what I need for the patient. And I'm going to need my 20 ml syringe to do this. I'm going to tell Mrs. Jones again what it is I'm going to do. Make sure she's safe, provide privacy, tell her I'm about to remove her catheter. I'm going to unloosen her catheter strap. And I'm going to put her catheter bag up here since I've already emptied it. Now that that's been done, I'm going to attach the syringe to the port. I'm going to explain to her to bear down, and I'm going to start to remove the water from the balloon. I'm slowly pulling back all the water. Making sure I got it all. The tube is collapsing. All right, that's all of it. I'm gently, slowly going to remove it. Making sure when I remove it, I'm looking at the tip of the catheter to make sure that it is in place. Once I know that it is in place, I'm going to put everything in the paper towel. I'm going to fold it. I'm going to discard it in the trash. I'm going to take my gloves off. I'm going to wash my hands. And I'm going to apply more gloves. I'm going to provide peri-care if I need to provide peri-care again. And then I'm going to cover the patient back up. I'm going to make sure that the bed is locked in the lowest position, that the side rails are up, the patient is comfortable, and then I'm going to do some education for the patient. I'm going to tell the patient that the first time that they void, it may be painful, but that's not unusual. People do that once we remove the catheter. I'm going to also let them know that we need to encourage PO fluids. That's going to help flush that bacteria and stuff out of the kidneys. If you haven't voided, I'm going to make sure the call light is in place because I want you to call me the first time you have to go to the bathroom so I can measure it and observe the urine for clarity and odor and amount. If you haven't voided in 6 to 8 hours, I definitely need to know that because I'm going to have to call the doctor and see what it is that he wants me to do. Okay, so once we do that, call light is in place, I've got water, they're comfortable, bed is in the lowest position, side rails are up, gloves off. I'm going to go to the chart and I'm going to document how the patient tolerated the procedure how they tolerated the date and time, type of procedure that we did, the tip of the Foley catheter when I removed it, how the patient tolerated the procedure, and what the clarity of the urine when I removed it and emptied it in the tub. Before I left the room, I made sure that the patient was safe, bed was in a lowest position, bed was locked, call light was in place, and they knew what to do the first time they boarded. And that completes my demonstration of how to remove female catheter. Now, with the male, I'm going to do all the same things that I did to prepare for the female. So the only thing, I'm going to go right into talking to how I'm going to demonstrate and what I'm going to do. So with the male, I got to make sure my gloves are on. Wash my hands, put my sterile gloves on. My sterile gloves are on. Everything I did for the female. So my sterile gloves are on. I've went and explained everything. Now I'm going to put the fenestrated drape on him with the shiny side down. Okay, so I've got my drape on him, shiny side down. If he's an uncircumcised male, I would need to make sure that I pull the foreskin back before I do the procedure. I'm going to let him know that I'm going to touch him, so I'm going to touch him. I've got my swabs. I'm going to grab my first swab. I'm going to go down the urinary meatus, get rid of that. Then I'm going to go down my second swab, start at the urinary meatus and go all the way down to the coronal ridge, get rid of that one, and then down to the coronal ridge. Let me back that up. So first one, I'm going to start at the urinary meatus all the way to the coronal ridge in the circular motion, get rid of that. Then I'm going to start at the coronal ridge and go down the shaft in a circular motion, get rid of that. Then I'm going to go straight down the urinary meatus and get rid of that. Once I've done that, I'm going to grab my catheter. Everything's been attached and in place. I'm going to grab the tip. I'm going to lubricate it 5 to 7 inches. Once I've lubricated it 5 to 7 inches, I'm going to look at the male and I'm going to tell him to bear down that I'm about to insert the Foley catheter. I'm going to go in 7 to 9 inches. And then I'm going to go all the way to the catheter port where we instill the water at. Once I get there, I'm going to pull my fingers down, grasp it. Then I'm going to instill the water. Once it's been instilled, I'm going to tug. It's in place. Now I'm going to come down here, unconnect the normal saline, put that in the trash, and then I'm going to make sure that I pull the foreskin back. And then I'm going to make sure that I provide peri-care, make sure that I document bed is in the lowest position and patient is comfortable. And make sure that I put a leg strap on the patient.